Despite the strong efforts by the government of Belarus and the international partners, Belarus is now experiencing a larger COVID-19 outbreak, characterized by sustained and pervasive local transmission. On Sunday, 26th of April, the Ministry of Health confirmed over 10,000 cases of COVID-19 infections in the country. This number is going up exponentially. Remember that on 26th of March it was only 86 cases. In addition to the strong response of the health and epidemiological structures of the government, supported by the heroic efforts of medical workers, now it is time for urgent and comprehensive implementation of physical distancing measures. WHO recommends physical distancing and postponing of all large gatherings of people. WHO also recommends introducing options for telework, distance learning, and suspending the operation of all non-essential workplaces, businesses, and economic enterprises, including factories, retail stores, markets, restaurants, and cafes. WHO also recommends reducing non-essential movements, especially for high-risk groups and the vulnerable patients, including travel between cities and towns, villages, including the trips to a dacha. Community-wide public health measures that prioritize physical distancing can help prevent and slow down the spread of the virus, allowing healthcare workers the opportunity to equip themselves with appropriate capacity, including beds, isolation wards, intensive care units, and protective equipment to respond to the anticipated increased caseload. Working as one, the United Nations funds and programs of the UN development system in Belarus are responding to the needs of the Ministry of Health and the Ministry of Labor and Social Protection, as well as our partners in the Belarus Red Cross Society and a range of other institutions and organizations that are confronting COVID-19 on the front lines and who provide care and support to the most vulnerable persons. For all of us, the picture is clear. COVID-19 attacks countries and people as a ruthless killer. Even if you are young and strong, you can die from it. You may not know you have it, yet still you are spreading the infection. Nothing is more precious than life, and nothing is more painful than its loss among family, friends, co-workers, and members of our broader human community. Please stay home to stop COVID. This will help the medics, the businesses, and essential workers to do their job and tackle the crisis.